I'm Virginia Governor Ralph Northam, and you're listening to the Patients Come First podcast.
Hi, and welcome to this episode of VHHA's Patients Come First podcast. On this episode, we're going to take a closer look at big data, data visualization, and the way data is improving healthcare delivery. Joining us to discuss this is David Vaamonde, VHHA's Vice President of Data and Analytics and our in-house big data guru. David, welcome to the show.
Thank you, Aaron. It's a pleasure to be here.
As co-workers for the last several years here at VHHA, I've had a front row seat to witness the data wizardry of you and the analytics team and really gotten to know you, and it's been really fun. Before we dive into discussing data and all the awesome tools you guys work on, can you tell our listeners a little bit about yourself?
Sure. So I grew up in two places. I grew up in Caracas, Venezuela, and on the eastern shore of Virginia. That's where I graduated from high school, and after high school, I went on to the University of Virginia for both my undergraduate and graduate degree. When I was in graduate school, I developed an interest in really big data's role in improving public health and public health outcomes, not only across a hospital, but really across the whole world. It was 2012 at the time, and really the amount of computing power that was available then in processing these large data sets was really just a fascinating time to be in school. After my graduate degree, I sought out various different internships, and I landed here at the VHHA, where I was mentored by Dr. Barbara Brown, who recently retired. So that period took about 4 years, and now I have the honor to lead the data team here at VHHA with my two great colleagues, Ian Uman and Mike Catano.
It's been really awesome to see how VHHA's research team has just revolutionized what we do here in the healthcare world. You do a lot to emphasize a data and analytics approach that has produced some powerful interactive tools that leverage massive databases to deliver insightful and actionable healthcare intelligence, and it's available to help Virginia's hospitals and health systems, as well as educating the public and legislators to help them understand some of the complexities of population health and care delivery. As someone who's personally used these data tools, I really sometimes marvel at the amount of granular detail that's available. Could you tell our listeners about a few of the software-based tools your team has developed, how they can be used, and how they can help improve healthcare delivery?
Sure. So here at VHHA, we really have two types of tools. We have our public-facing tools and our member-only tools. So let me start first with the public-facing tools, since these are readily available on VHHA.com. and anyone can access and get to them right now. So the first dashboard is the Quality and Patient Safety Scorecard. This was a scorecard that was originally developed in 2015 before my time here. Basically, it came about because the board of directors at VHHA really wanted to explore and to more or less give consumers a picture of what the healthcare looked like from a hospital-to-hospital basis in terms of quality and patient safety. So the scorecard was developed with different metrics in mind. As time moved forward, the metrics just kept getting larger and larger and more confusing. So when I first started at VHHA, one of my first projects was to really take this scorecard and turn it into an interactive and online tool that could be readily available. So what we did was that we condensed the information down, and we used this new tool called Tableau to really format it in a way that could be easily read, and also had definitions and tooltips, and had different interactivity components, like, for example, just going on there and selecting what hospital you want, and the dashboard would basically immediately populate itself with corresponding metrics. The next dashboard that I'd like to go over is the legislative dashboard. With this dashboard, it was really an advocacy tool that we created, and primarily what we were trying to paint a picture of was, what does community health look like at the legislative district in Virginia? As you know, legislative districts don't really follow the exact boundaries of a zip code or a county. And so what we wanted to basically show in this new tool was, okay, well, how many hospitals are there in a particular legislative district? Or what is the economic impact of the healthcare industry in a particular legislative district. With this information, we also mined some health stats, and we were able to show things like the incidence of diabetes in a particular legislative district. All of this led to basically synthesizing a dashboard in which the user can ultimately go and select their legislator or their legislative district, and the dashboard will automatically populate itself with all of this information on the healthcare industry in that particular area. The third dashboard that I'd like to go over is the patient experience dashboard, and this dashboard was created by my colleague Mike Gaetano. This dashboard includes information on hospital performance and patient satisfaction in the HCAHPS survey, and this includes factors such as the cleanliness of the facility, the responsiveness, and things like doctor communication, patient discharge communication, etc. One of the things that I really like about this tool is that not only does it tell you how the particular hospital ranks in the state as far as these different factors, but it also gives you the links to really best practices on how to improve your score at your facility for these particular metrics. So we really found that tool to be really helpful to share with our members and for them to be able to not only see where they are at, but also give them the ability to do something about it with this additional information on how to better your metrics. The next set of tools are really member only, and these can only be accessed by going to VHHAanalytics.com. Here I'm going to go over two dashboards that we found particularly interesting and we thought we would share with you. The first dashboard was created by my colleague Ian Uman, and this dashboard looks basically at the incidence of opioid usage and utilization across Virginia. As you know, the opioid epidemic is national and it's getting a lot of attention. And so one of the questions that our membership had for us is, what are we going to do about the opioid epidemic? And more specifically, how are we going to track it and how bad is it? So Ian went to the all-payer claims database and basically was able to mine a lot of information on prescription volumes all the way down to the patient level. And what he did with all of this information was that he created basically a database where you're easily able to see patients that show up in an emergency department and receive multiple prescriptions for an opioid as a result of their visit. By using this dashboard, we've been able to identify patients, for example, that have gone to 5 different emergency departments in one day and received prescription drugs from 3 of the 5. So this information we thought was very useful, and when we rolled it out, a lot of our members that are subscribers to our tool didn't know that problems across the multiple emergency departments were that pronounced. The next dashboard that I would like to cover is the Readmissions Dashboard, which tracks patients that are readmitted to the hospital within 30 days. This dashboard was particularly useful for clinicians because the readmissions data and the database are very confusing to understand. And what we did was we put it into a format where the clinician is able to drill down into their hospital volume and then take a look at the patients on an individual basis and find different trends among why and how they're being readmitted.
Well, as somebody who deals with the VHHA.com website, I can certainly tell you that these dashboards that you and your team have created are some of the most viewed pages on our website. So clearly our members are getting bang for their buck. I'm interested in knowing, out of all of those dashboards and the dozens of data tools your team has developed, I'm interested in knowing which has been your favorite to work on and why.
I think that's a great question. I think ultimately my favorite dashboard and favorite project that we've worked on here is the readmissions toolkit that we have. The main reason why is the scope of readmissions as a problem in healthcare in general. So the Agency for Healthcare and Research Quality estimates that hospitals spent $41 billion in 2011 on preventable readmissions. And so one of the reasons that we thought tackling readmissions in our analytics toolkit was such an important thing was really because of the impact that we could make. And now that the tool has sort of matured and people are using it more, we really get to see how certain clinicians that are not really interested in data and analytics are actually going to the site and using our tool. And I've received at least a few comments of particular nurses that have used the tool to create care coordination plans and to implement solutions to ultimately bring their readmission rates down. And I see that as really just a big victory in what data and analytics can do for our members.
Well, that's certainly great news, and it's great that our members are finding value out of these dashboards, although not surprising at all. So you've given us a sampling of these projects that your team has developed. Can you provide us a sneak preview of what's exciting and new and coming soon at VHHAanalytics.com?
Sure. So I mentioned previously a patient experience tool that we created. One of the topics that we ultimately would like to explore in these next couple of years is really mining reviews from platforms such as Google, Yelp, and Facebook. One of the reasons that we want to do this is, and I'll have to admit here as a millennial, I use Yelp to look up a review of a restaurant before I go to a restaurant.
I do the same thing.
Increasingly, I've noticed that hospitals are also getting reviews on these different social media platforms, and I thought it would be a really neat project to mine some of these reviews from these various social media platforms and ultimately build out a dashboard in which we can sort of show our members what their social media presence is like, and also give them tools on how they could improve this to really stand out on social media.
That sounds like it's going to be really interesting and something that I'm certainly excited to dive a little bit into. But not everyone can take a deep dive into data, so for those who are looking for more of an overview, David and his team for the last few years now have produced these bi-monthly research corner columns that are available online at www.vhha.com/research. Each of these short columns explore a healthcare subject by using data to identify trends related to the opioid epidemic, diagnostic testing, healthcare utilization, and so much more. These columns really provide an entry point for data novices like myself. So thinking about that, David, I wonder who inspired or still inspires you in the world of healthcare big data and data visualization?
Someone that comes to mind immediately is Dr. Gawande, who is someone that inspired me when I was in graduate school and continues to inspire me because of the work that he is doing to disrupt the healthcare industry. This came more recently with his appointment as the CEO of the new joint venture between Amazon, JP Morgan, and Berkshire Hathaway, in which these three companies ultimately aim to bring healthcare costs down. So I'm very excited to see what Dr. Vaamonde is going to be doing these next couple of years with his leadership in that joint venture.
Well, thanks so much, David, for taking the time to be with us today to discuss big data in healthcare. We hope you enjoyed this episode, and we invite you to listen to others in the Patients Come First series by visiting our website at www.vhha.com. Also available on our website is the latest issue of VHHA's Review magazine. Review highlights interesting stories from hospitals around Virginia, and the summer 2018 magazine issue profiles programs and strategies put in place at hospitals throughout Virginia to combat the opioid epidemic. You can read the magazine at www.vhha.com/communications. And that'll do it for this episode of the Patients Come First podcast. You can find us online at vhha.com, and don't forget to subscribe to us on SoundCloud and Blueberry.